So let's start with the levator scapula. Levator scapula is going to be C1, C2, C3, C4, and it's going to be on the superior angle of the scapula. Now face up, you can find that by tracing the spine of the scapula and finding your way to the end, and then now we're hitting the, can you see from there? If you, yeah, I can't, probably just behind me here. Okay, here we go. So your AC joint is right here, clavicle and spine of scapula. I'm gonna trace the spine of the scapula all the way to the end, and that should allow me to access the superior angle. Now this crunchy feeling right here is the attachment of the levator scapula. So you can work it a few times to release. Sometimes it's painful for people, but here we go. Cross fiber, we're working kind of in and out. And then I'm gonna trace it all the way to the spinous processes, or to the C1, C2, C3, okay? Now another way to, now in this position we're already, the levator scapula helps in rotation. So right now I'm already in a position where I can stretch it. But you can see the scalenes are also tight. Okay, so I'll just add some lotion, just give me a second. And then of course here, the AC joint, we got the deltoids, right? We got the deltoids right here, I'm over them. I got the upper traps right here. And then I got the back of our cervical spine right here. You can go circular motion, you have a lot of attachments there, so, or you can go back and forth, or we can go longitudinal on the muscles, kind of going up and down to release them. Okay, next muscle here we're gonna work on is gonna be your pec major. Pec major is gonna be attaching to the sternum and to the clavicle, and take the arm open a little bit, to the humerus. So as you can see, this is part of the pec. Oh, we're gonna just bend the elbow but keep the arm open to give it a little easier on the shoulder joints. Okay, first we're gonna work it in superficial way. It is usually very tender on men and women, because usually it's not worked and massaged often. Keep the palm nice and flat and try to bring blood flow to the muscle. Working down, because I want to access the teres, the pec minor, which is underneath. So now I'm going across the muscle, just stretching. You see how it's pulling on the neck? It's pretty tight, especially the attachments to the clavicle. Now I have here the shoulder joint, the humerus, okay? The head of the humerus, coming with the scapula, and we're gonna work also the biceps, because they attach where? To the acromion process. So how to find that? We have two ways you can find it. We find and locate the AC joint. Right underneath it, it's gonna be like a ball, and that's gonna be your AC, your acromion process that attaches to your biceps. Okay, that's one way to do it. Another way is you could look at the groove of the pec and the deltoid groove, and it's usually right there, okay? But it's right here. You can definitely see it. All right, so what I'm doing is I want to lengthen those tendons and those fibers. So I'm going in the length of the muscle. Just deep glide, that's what I'm doing, so I can straighten up the fibers. And because of our posture and normal day life, we're always in inward rotation to the shoulder. You want to push it outside and lengthen that shoulder. So I can come in with the compression of the pecs from the sternum, gliding down with the palm of my hand, all the way till I get to the pectoral groove. Sink in. Here's where we're going to actually sink in more into the attachment of the pec minor. And just going over the acromion process and out. Now here, the acromion process, if I go in and deep, I'm gonna get into the pec minor. It's pretty tender. You can also go with the thumbs down in an angle. And you can hold and ask for a breath. It attaches to the ribs, to 3 ribs. And it's pretty short. Now, what I could do is I can maybe open that arm a little bit more like that and extend the arm in the direction of the pec major. That would allow me to kind of go in deeper to open up the pec minor. Now this is part of the pec major. Again, we don't want to go into sharp tools because this is a tender area, and I can just support the wrist and do some deep glides on that. Okay, now I have access also here to the deltoid, the anterior fibers to be more exact. So anterior fibers right here, I'm going across them, and these are the upper pec fibers. And this is the anterior fibers. Here we got the biceps, see? This is the biceps. So now what I'm gonna do is go and place that hand behind his head so it can stabilize the hand and help him relax. I'm gonna come this way. And now we're gonna try to dig into the subscapularis. How are we gonna do that? So we got the scapula, this right here. I'm gonna find the lateral border of the scapula, which is right here. Right here, I find the edges of the scapula right here, okay? And this is the inferior angle of the scapula where the lats attach to. So along that, I have my lateral border. What I need to do is sink into that border inward to get the subscapularis. It's a thick muscle, and I'm trying to get over the border to dig down into the fossa. Takes a little patience, but I want to follow the border, so I want to stay on it. Alright. See, now it's a little looser, but now it can go up and in it. Push it down. Feeling all right?
Yeah.
Okay. All I could do is pretty much compress that muscle, not much to it, okay? Now we have to understand now we got the serratus anterior right here, connecting to those ribs, lateral ribs, and the scapula from inside. So it's a muscle that moves as we move the scapula that way. So we can also pull them off the ribs to massage them. We can also put the person sideways, but I have the angle right here of the scapula. Yeah, right here. This is the bottom angle, and this is the border. So I know that they're coming that way, those fibers of the anterior, serratus anterior, okay? Now we be careful with this area because that's one of the caution area for massage, but wide compression is fine because it houses lymph nodes, veins, and nerves, okay? But that's what we can do with this area, like gentle compression and wide. Gentle meaning you approach it gently, but it's pretty firm compression. And allow and stretch the chest and separate the tissue if possible. You can have them relax the arm up and create that little nice stretch right here for the shoulder. This is great work, and then as we go, we can add a little bit more movement for the ribs. We can do stretching for the ribs or the chest itself. Okay. One more exercise, more movement we can do is to open up the shoulder some more, because ideally the shoulder should be a little bit more open, more like this, but with life it goes more internally rotated. So we can open up the wrist first, the forearm next, because they contribute also to the rotation of the shoulder to go internally. You can compress the bicep, pull the fibers laterally. And as we get up here, we kind of want to give it time to release, so we don't have to be so rapidly moving over that joint. Allow the joint to take in the pressure and release the tension, and allow the fibers to lengthen. Okay, it's a little bit better. And again, you can do more compressions on the top of the chest and allow them to take a breath and release. And a little shake at the end, doesn't hurt. Release the nerves, the brachial nerves. And that should probably help a little bit.